welcome to ctac Talks, an innovative video series addressing treatment access issues and solutions for Canadians living with HIV and hepatitis C. The Canadian Health Coalition and Carleton University School for Public Policy and Administration hosted the Pharma Care 2013 conference in Ottawa. And I'd like to highlight some of the key points raised regardless of which side of the debate you're on as to whether Canada should or could have national drug coverage. So here are a few things that you should know. Universal drug coverage is not a new political or economic topic for Canada. It was recommended in 1964 and then again in 1997. And despite lots of momentum, we still don't have it. However, 78% of Canadians support universal drug coverage, and 9 out of 10 Canadians believe that drugs should be afforded to Canadians based on their medical needs, and not based on their available disposable income. Of all the countries with a universal healthcare system that form the OECD, like Medicare in Canada, Canada is the only country that does not include universal drug coverage in our overall healthcare system. Because long ago, Canadians decided that there should be public payment for doctors and services, but we did not include prescription drug coverage in the plan. Therefore, the reality of drug coverage in Canada today is that it resembles the American system, where it's public for some, private for others, and out of pocket for the rest. What we have in Canada today is a patchwork of public and private drug insurance plans. There are 19 publicly funded drug plans in Canada, and these programs complement the more than 1,000 private drug insurance programs offered to employers, unions, and professional associations across the country. These private plans vary significantly in terms of eligibility, benefit payment structures, and drug formularies. About 59% of Canadians have private drug coverage. Nationally, 53% of Canadian prescription drug costs are reimbursed by private insurance. And drugs represent 60% of medical costs for employers through employer-sponsored drug plans or group insurance, and the amount continues to increase. Most drug plans as they exist are not sustainable because they cover all drugs without restrictions. Drug costs continue to rise exponentially, so to balance the impetus of that, there is a lot of pressure by employers to reduce drug coverage. With the increase of specialty and biologic drugs and the financial burden of that falling on employers, we need to find a new management technique moving forward. The existing drug plans in Canada are uneven, unfair, and unstable. Here are some examples. 2.7 million Canadian workers are self-employed, so the way things are now, they can't get any coverage. Part-time workers are covered less than full-time, women less than men, ununionized less than unionized, etc. And none of this has anything to do with the person's health status or need for drugs. And if you are covered, it's not 100%. So paying 20 to 40% of costs is a huge burden if you need a specialized drug or if you have a chronic illness. And none of this is based on your ability to pay. And let's not forget that over 90% of people living with HIV and hepatitis C in Canada are currently accessing their drugs through a catastrophic plan. Pharma Care has many advantages. A national Pharma Care plan would provide equal access to prescription drugs, replacing our uneven patchwork of provincial programs and private insurances. It would also control costs by allowing providers to negotiate good prices and reduce administrative costs. It would improve drug safety and improve prescribing practices as well. Like so many other industrialized countries, Canada can afford a national drug plan. We already pay for our drugs, but Pharma Care would let us do so more effectively, more economically, and more fairly. Because costs represent barriers. Costs impede patients from filling essential and non-essential prescriptions, and we know that when this happens, it burdens the healthcare system in other ways. So let's open up this conversation and have you participate through our discussion board. What do you think the positive and negative effects of UDC are on the future of HIV and hepatitis C medications in Canada? So that's ctac Talks. Let's continue the conversation on the ctac blog and join us in addressing